Hi, I'm Joni Beasley, and I am a research professor and the director of the National Research Consortium on Intellectual Developmental Disabilities and Mental Health. And I'm here today to provide a brief training on cross-systems crisis prevention and intervention planning. Just a little background. I have been in the field since 1976 in mental health, serving people who are at very high risk of crisis. And as somebody who worked directly in the field, I was a clinical director and direct support staff before that with people with mental health needs. One of the things that really was problematic was how to get help when you needed it, for people when they were in acute crisis, and even how to define what a crisis was across systems. So knowing who to call, when to call, knowing what to do, these were all things that were of great concern. So back in 1985, I developed the first cross-systems crisis prevention and intervention plan. Later on, it became even more important in working with people with intellectual and developmental disabilities and mental health needs, which I'll talk about in a minute. So I'm going to start with one of my favorite quotes that really motivates me in this work. So when we talk about cross-systems crisis planning, one of the things that we have done previously in the field, especially in the 80s and 90s, and even in some cases, in some places today, is people end up with these terrible reputations. And as a result, crisis planning is what we're going to be doing to people rather than with people. And it's very important that when you think about crisis prevention and intervention, you're collaborating in partnership with people who are having difficulty. You're not doing something to them. And a very important leader in our field is the late Herb Lovett. And this is a quote from a testimonial that he gave in Massachusetts at the Council on Developmental Disabilities many years ago. Herb said, "Time after time, I have found that when people are taken seriously, when they are respected, when their behavior is interpreted, understood, and responded to accurately, when they are engaged in mutual dialogue, rather than subjected to unilateral schemes of behavior management, somehow, as if miraculously, they become more ordinary. I know a number of people who've had severe reputations who have shed them when those supporting them listened more carefully." So the idea in evaluating high risk for crisis is really listening to the words of Herb Lovett, remembering that we're all human, we all have difficulties, and this could be any one of us that we're talking about, and really not letting the severe reputations overshadow the ability to partner and be effective in strategic planning around crises. In 1988, I developed a project called START with some colleagues in Northeast Massachusetts. And START is a systems linkage evidence-based community crisis prevention intervention program. And it serves people throughout the lifespan. And a primary goal of the model is to build capacity to address problems and prevent crises from occurring whenever possible. And the cross-systems crisis prevention and intervention plan is central to this goal. And in fact, when I wrote the first description of START and how we were going to develop it, it was really around what I learned from cross-systems crisis prevention and intervention planning. So before going to the methods used, I just want to take a step back and talk about what are we talking about when we're talking about a crisis. A crisis is a problem without the tools to address it. A crisis is a problem without the tools to address it. It can happen to any of us. So, for example, I'm going to give an example of me. If I am in a place where I end up driving my car and have a flat tire, and there's no phone availability. It actually happened to me once where there was like no bars on my phone and I had a flat tire, and I didn't have a jack or a spare in the car. And so I did not have the tools to change the tire or deal with the flat tire. That becomes a crisis because nothing else matters when you're stuck in a car and you can't drive it forward. Everything else sort of is overshadowed by this urgent need to resolve this problem. And not having the tools to address it makes you feel very anxious, very uncomfortable, and feel like this is a crisis situation. Now, a crisis is a problem without the tools to address it. If I had the jack and the spare, and I had the knowledge about how to use the jack and the spare, then it would have been a problem. It would have been a pain in the neck, but it wouldn't have been a crisis. It would have slowed me down, but it wouldn't have made me anxious, maybe angry, but not anxious. And, maybe I'd feel sorry for myself. Maybe my hands would be dirty, but I wouldn't be anxious. Now I'm giving you the hypothetical, maybe my hands would be dirty, because I'm somebody who, if I had a flat tire and I have the tools to address it, I don't have the knowledge about how to use those tools. So by extension, a crisis is a problem without the tools to address it and the knowledge of how to use those tools. A crisis is a problem without the tools to address it and the knowledge of how to use those tools. Very, very important. So when you're writing a crisis plan or thinking strategically about cross-systems crisis prevention and intervention planning, not only do you have to have the tools to address it, but the knowledge of how to use those tools. And sometimes that takes practice, right? So you don't just say, this is what the jack is for. And have you ever gotten instructions, like an instruction manual, and they say, oh, you assemble it by doing A, B, and C, and they're complicated instructions. And you sit there and you're like, oh my God, I have no idea of how to do this. That would be me. That would be me. So what are the methods that we have to use in order for a cross-systems crisis plan to understand that there are problems and face those problems with the tools to address them and the knowledge of how to use those tools? Well, the first thing you need to have is person-centered thinking. If you take the example of me and crisis situations with tires, with flat tires, if you think about me, can't read a manual, do not have the knowledge. And I also am too fearful to really learn at the age of 67 how to change a tire. I'm not saying people can't learn. I'm saying I do not have the capacity to learn that. So in a person-centered thinking crisis plan, for me as a driver, I need something called AAA, which is, hello, can you come change my tire? That's my crisis plan. And that is very person-centered. There are many people who don't need that, but I need it. There's also, in our thinking, something called the tertiary care model of crisis intervention. So the tertiary care model is a model developed by the World Health Organization to address situations that might occur. And we'll be talking about that a little bit more. I believe in strength-based practices. And in the 80s, there really wasn't a lot from Marty Seligman, Dr. Seligman yet, but as positive psychology evolved and my practices evolved, I took a lot from the work of Dr. Seligman and positive psychologists to apply to the work that we do. So when you're thinking in a person-centered way, and you want to have the tools to address things and the knowledge of how to use it, the best way is to know what the person's character strengths are and abilities are as part of the intervention itself. And so we do that, including the intervention of calming yourself down so you don't freak out when you have a flat tire, right? You also have to think about what is effective services, and we'll talk about that. The concept of synergy, we'll talk about that. We all know that when we have a mental health need, that having evidence-based mental health practices integrated into our planning and implementation strategy is very important. But also, if you have somebody who's helping you with this, how do you provide coaching to get there? How do you think about that mental health need? A clear understanding of the person's diagnosis and treatment plan. And remember, mindfulness, health practices, and knowing what works are very, very important. So in a good crisis plan, you would really articulate what works and also what doesn't work with an individual. Things like expressive and receptive language, the way a person processes and thinks, these are all very important to crisis planning. So let's start with the tertiary care model. As you can see, the tertiary care model with regard to the capacity and crisis planning should allow, the plan itself should allow all three levels of tertiary care. So what is tertiary care? Tertiary, the term tertiary means three or third. So at the bottom here, these interventions facing the odds of a crisis. What do you do when things just don't work out? All the things you've tried are not working and you're still having difficulty. You need to face those odds and figure out what to do about it. So in the crisis plan itself, you need to say, when this happens, go here or go there. It's usually going to the emergency department or calling the mobile crisis team. It's usually an intervention outside of the person's primary situation that is tertiary care. If you have a crisis plan that just plans for a crisis, what will end up happening is that tertiary care will just be stuck with this facing the odds intervention. If you wait until all you can do is go to call the police or go to the hospital, all you're going to do is go to the police or go to the hospital. Secondary interventions beat the odds of needing tertiary interventions. How do we do that? By developing skills, by practicing, coaching, using what we've learned, using our expertise as caregivers, helping the person get through the difficult time and beating the odds of things having to emergently be addressed outside of the person's primary setting. The thing we're all working toward in all cross systems, crisis prevention and intervention plans is called primary intervention. Now, in crisis planning, prevention is really a primary intervention. What it means is that we know the person has difficulties. Everybody does, after all. And so what the primary intervention is changing the odds from those difficulties requiring additional help from secondary or tertiary intervention. And so we're all practicing up here. And what I'll be talking about today are things to do in that primary category to keep you from needing these things. Now, we need all three because that's just the way it is. But what we're really trying to do is stay right up here at primary. The potential impact of primary intervention is that you have lots of choices and options, and life is much more predictable up here. Now, what do we know about trauma? Primary interventions are the most trauma-informed interventions you can have. Once you move down to secondary and tertiary, that can be compromised by the loss of control that the individual has and the predictability that the day is going to take as you bring in other people into the person's life to address the problem. The other thing we talked about is effective services. Effective services are measured by 3 A's. I developed this back in 1997 when I was trying to study the First Start program and trying to define how we think about effective services. And I came up with access, which means services have to be timely and available, appropriateness, they have to match the real needs and provide the tools to address whatever it is that you're trying to address, and accountability, responsiveness, engaging, flexibility, and creativity, the ability to pivot. Clearly, in order to have a crisis prevention and intervention plan that works, you have to meet these 3 criteria for effectiveness. The other thing that you want to do is think about how you intervene in a crisis. What happens when a crisis occurs? So I'm going to tell you a little bit of a story here. Not that many years ago, about 10 years ago, my mother, who was, had a lot of medical issues. She was in a wheelchair. She was at my home having Sunday lunch, which she attended every week, and we played Scrabble together. A funny story about my mother: when she won in Scrabble, she said, "Of course I won." If I won in Scrabble, she said, "Of course I won, because she taught me everything I know." So my mother was a big winner. One day, we were sitting at the dining room table, and suddenly, as if out of nowhere, she was unable to breathe. When she was holding her neck and said that it was very painful, she was unable to breathe. My husband and I went into a complete panic. We called an ambulance. And by the way, when you're in a crisis, so a crisis is a problem without the tools to address it. Even though I called for help, which one might consider as a tool, because she was unable to breathe, we were in continuous crisis, right? Because the problem right in front of us was the pain she was in and the inability to breathe. So the ambulance came, and it felt like it took hours, but my husband said it was like 7 minutes. It really wasn't long. And immediately they gave my mother oxygen, and she was able to breathe. Not only was she stabilized, but we were stabilized. It was as if nobody was able to breathe in the room. And as soon as they brought the oxygen, and gave it to her, we were all able to breathe. So think about, and I use this for training STAR coordinators. And if anybody of you know any STAR staff, they'll talk about giving oxygen as a crisis intervention strategy. That comes from this story of my mother. This is in my mother's memory that I tell this story. Really, the first thing you need to do is realize that nobody can breathe, and you need to bring them oxygen. And that has to be addressed immediately in your crisis plan. What gives people the opportunity to calm down? What does the person need in that moment that addresses that? Not getting into all the other things that you might have to address a few minutes from now, or half an hour from now, or an hour from now. Right now, what you need is oxygen. The second thing you need to remember throughout your planning is to both acknowledge the person's humanity, but also show your own. If I go back to the situation with the people in the ambulance, they didn't act like robots. They looked at my mother. They used words like, "I'm here. We're going to take care of you. It's going to be all right." They talked to me and said, "We're going to take care of her. We'll get her to the hospital. It's going to be all right." There was some reassurance there. There was some humanity. It wasn't just mechanical, right? So have empathy when somebody's suffering. Don't just intervene. So an example of a bad crisis plan is when somebody's really getting agitated, telling them to go for a walk as an intervention without ever saying to them, "I'm sorry you're upset. Would a walk help you?" Something like that. I mean, there's a difference in those two approaches that are very important to keep in mind. Crises, whether they're small problems without tools to address them, or larger problems without tools to address them, can be traumatic for the people we support, and for all of us, right? So that moment with my mother was traumatic for her. It was also traumatic for me as her daughter. I'll never forget that moment when my mother couldn't breathe and I didn't know what to do to help her. And so in situations of trauma, remember the 3 things that people need in order to address the trauma and not get stimulated by the trauma. So what happens when people get stimulated by trauma? What happens, amongst other things, there is the fright and flight response, which we're all worried about. But there's also this sense of not being able to think straight. Like when I was in the middle of this with my mother, I thought it took too long for the ambulance to come, too long. It was because every second was traumatizing because my mother couldn't breathe. Every second. So it's all sort of blown out for the person in the middle of the situation. So the first three things you need to be able to provide are safety, predictability, and choice. Safety, predictability, and choice are the three things you need to incorporate into any crisis plan. And the other thing, my friend Dan Tomasulo, who's a positive psychologist, has always told me is hope is a plan. So helping people to know what is going to happen next that is going to be safer and better for the person. So in the case of my mother, we started planning on how to get her to the hospital, on how I was going to get to the hospital, how my husband was going to get to the hospital, and what would happen next. And that was all very, very helpful. And so these are the basic steps that you need to incorporate into any crisis prevention and intervention plan. So a cross-systems crisis plan must be applied across providers and caregivers. So you can't really have a plan that you don't share with the other people you're going to include in the plan. Now, that sounds silly that I'm even saying that, but I can tell you in the early days of crisis planning, group homes would create crisis plans about when they were going to call the mobile crisis team without talking to the mobile crisis team about it. And then what would happen inevitably is the person on the other phone, on the end of the phone, would think, why are they calling me for this? This isn't my role. What is it that they want from me? Part of it is the language that you use when you connect with each other to make sure that you have a common understanding. And part of it is the connection so that people know what they're doing and what others are expected to do as part of the planning. So you have to, it has to be applied across providers, and that requires linkages. Now, we're the link team. We all know that linkages are key to our success. As I said earlier, a crisis is a problem without the tools to address it. Defining that problem in stages and phases so that you can know what the tools are to address it and be clear about how to use those tools is very, very important. A crisis plan maps out a strategy to recognize and address the problem so that it doesn't become an urgent crisis, right? This requires engagement with the person you are helping and the people needed to assist them. So everyone needs to be engaged in this process. It requires knowledge of the person, their preferences, what works and what does not work should a problem arise. You need to allow for maximum communication and collaboration with the person having difficulty. So knowing their expressive, which is the way you speak, and receptive, which is the way you understand when other people speak, is very important. Knowing primary language versus secondary language, especially with regard to expressive and receptive language, that can be tricky. If you don't know the person and they speak very clearly, you might think that they understand everything you're saying very clearly, and that may not be the case. If they're unable to speak very clearly, you might assume that they don't understand you, and that might not be the case. It may take time for somebody to process information, but that does not mean that they can't process information. They may be taking a long time to process information, and that's not ordinary for them. And that might mean that they're experiencing trauma, and you're unaware of it because you don't know them well. So knowing how people communicate is very, very important, especially when the person is having difficulty. So let's remember that collaboration is an action. It's essential for our work. The action of working with somebody to produce or create something is the definition of collaboration. Synonyms of collaboration include partnership and cooperation. It requires a structure to accomplish this. And I suggest that the cross-systems crisis prevention and intervention plan can create that kind of structure. It requires investment on the part of the collaborators to move in the direction so that together they're successful. It requires dialogue and engagement between partners. It requires clarity of roles and responsibilities toward your mission. And it needs to be practiced on all levels of crisis prevention and intervention implementation every day. So all of these things, collaboration is required to prevent a crisis, to intervene with a problem, and to intervene with a crisis if necessary. There are various levels of collaboration that take place in the work that we do. With the people we support, with the families of the people we support, with the providers of the people we support, with each other as a team, with other teams, with funding sources, with the national network that we're created here with the Link Center, and with each team has a mechanism in place for linkage agreements and advisors to enhance their capacity when working with people who are at high risk of crisis. And remember, it's not about the pillar of the plan, it's about the person. Crisis prevention and intervention plan is not about the format you use, it's about the process you employ in developing the strategic plan. You must incorporate what you know and discover what you need to know. So one recommendation is, anytime you implement the crisis plan, you reconvene and talk about what got in the way of preventing it from being a stage 1 intervention versus a stage 2 or 3, should that have occurred. It has to provide hope, which means a plan for improving things in the future. It must promote capacity building. We can do better. From listening and learning, we can do better. It's not about a cause for the difficulty or to cure it completely. It's about addressing the inevitable stressors in life. What I didn't tell you was my mother at the time had a condition called heart failure. So she was on oxygen. Well, no, she wasn't on oxygen at the time, but she was in heart failure. Her heart was having some difficulty prior to that day that she was unable to breathe. What turned out happening was that she had a heart attack. The oxygen that was given to her did not cure her heart disease, but it helped us with the stress and difficulty associated with this very acute situation. And really what you want to do is you have to measure what works to build capacity. So you need to look at your plan and make sure each time you use it, it's more effective until you don't need it anymore. So the idea is to get those primary interventions in place where it's really not a crisis, it's just a problem with that, and you have the tools to address it. So I'm going to show you this final diagram to talk about crisis prevention and intervention. And I'm using it because it is an example of what we have learned through implementation of the START model. So remember, START was developed way back in 1988. It is still going on here in 2023. The National Center for START Services is a partner with the Link Center, and I'm delighted to present this training as a result on behalf of the Link Center. And I wanted to show you a diagram of sort of how the Cross Systems Crisis Prevention and Intervention Plan works in real practice in a real system. So the first thing that happens when somebody goes into START is something called a provisional crisis plan is written. And that's with information that is available through assessments and what we learn from the person's enrollment and intake. It's not very well formulated, but helps to address what we need to know to do better. So, because for example, if you if you worked with a team that knew everything they needed to know about how to intervene with a crisis the minute you met the person and their team, then you have to ask yourself, why are they here? So the assumption on everyone's part is we all need to do better. We can do better. So what happens with START is lots of different avenues for consultation and therapeutic supports, working with creating linkages between the teams, the mental health and IDD system and other teams, providing outreach and training, and trying different mental health strategies, really working with the person about what works for them, what doesn't work for them, always thinking about positive psychology and a strength-based support to build capacity, and building that that linkage and collaboration. From all of that, we developed the Cross Systems Crisis Prevention and Intervention Plan. And START is on call 24 hours a day for urgent crises in response for the intervention. If that person ends up in crisis, it triggers the use of the crisis plan. Now, as you can see, it doesn't stop there. It goes all the way back to the beginning and getting more information, more processes, and it goes kind of in a circle. When you use a crisis plan, you need to ask yourself, what is it that we missed? What is there new information? What can we do better? You don't think of it as inevitable that the person's going to go into crisis and that the plan is to manage the crisis. You think of it as a process where you keep going, and what is inevitable is that we have problems and that we need the tools to address it. And through this process, eventually, you have a crisis plan, prevention intervention plan that is effective, accessible, appropriate, and accountable to the person and their system of support. Now, in START, this takes about 8 months to occur. So it's not an overnight sensation. You don't come in and say, we are the experts, we know everything. And that's all there is to it. Now, I'm not going to go into the whole diagram, but I have to tell you that at the end, what your goal is for anybody in crisis prevention and intervention is increased mental health stability and PERMA. PERMA is a positive psychology term that stands for positive emotions, engagement, relationships, meaning, and accomplishment, namely a fulfilled life. So cross systems crisis prevention and intervention planning should not just focus on managing difficulties, but promoting well-being and working together to get there, and knowing that the person themselves are the biggest asset that they have, and making sure that you take full advantage of engaging and encouraging the use of the assets that that person has. So I'm going to stop here. And I just want to say, oh, I can't do that because I have my people here. So I guess I'm going to, what should I do? Should I keep sharing, Carrie, and go back? I can't hear you.
I'm so sorry. Yeah, we can absolutely edit that out. So just start over where
Okay,
you feel
and then I'll
comfortable.
just talk. How did that go? Is that okay?
Stacy?
Yeah, no, it's great. Yeah.
Yeah. Okay, all right. I'm just going to go back to the last slide and say a few final things. Okay.
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 Great. Thank you.
Where's the thing?
I think you just need to go backwards in your slideshow.
Yeah. I'm like, where's the thing? All right. All right. So I think it's really important to understand and to look at all of the things that intervene when you're trying to get to PERMA, right? So there are things that really impact the cross systems crisis prevention and intervention plan working. And one of them is whether or not the plan includes building the capacity of the system of support in helping and using the plan itself. So using the strengths and abilities of direct support professionals, family members, friends, and others as part of the prevention and intervention planning strategy is key. The other thing that we need to keep in mind is that, and those are called mediators to getting to your final outcome. The other thing that you need to keep in mind is what impacts the final outcome that you wouldn't ordinarily include as part of your thinking, but is very, very important. So one of the things that we need to address is the way people of various racial and ethnic backgrounds are treated in the system as a whole and considered when having difficulty. And that can undermine their moderators, the success of your planning strategy, unless you face that as a team, as a system as a whole. The other thing that might either increase or decrease your capacity to be successful in cross-systems collaboration in crisis prevention and intervention is whether you're from a rural or urban setting. Now, all of you city dwellers, I'm from New York City originally, will think that urban settings are easier to get this done. It's actually, my friends, rural settings. In rural communities, people are much more used to sort of bending and being innovative and adapting to challenges they face, perhaps because everybody knows each other and they're part of a smaller community. In urban settings, there tend to be more silos, and breaking down silos is key to cross-systems collaboration and to linkages. So these are things you need to face in cross-systems crisis prevention and intervention planning. The level of intellectual disability definitely impacts what works and what doesn't work, but also primary health is something to consider. If somebody has a lot of health conditions that are not being addressed by the person and their team, they are going to be more likely to have difficulty regarding their mental health presentation. So making sure that their primary health and health practices are in good order is very, very important. And finally, people who have employment are less likely to have crises. I'll say that again. People who have employment are less likely to have crises. So when you look at cross-systems crisis planning, you may want to look at the person's life situation overall. Why are we worrying about this person being in crisis? What is the quality of their overall life that sets the stage for this continuous fear that they're going to have crises? And those are moderators that impact your ability to address the problems and face them in a way that's effective. Your primary outcomes are always the decreased crises events and the extreme outcomes in that tertiary level that we talked about. But really, as I said earlier, the most important outcome is increased mental health stability and a quality of life that allows for PERMA, positive emotions, engagement, relationships, meaning, and accomplishment. And this was written by Dr. Martin Seligman and his team to define really what the underpinnings and aims of positive psychology are. They work very effectively when you think about them in cross-systems crisis prevention and intervention. I want you to consider the development of any format or form that you use, that the first thing you have to do is really address all of the things that I talked about today. While I have a format, there are many others that can be effective. It's really about your training, knowledge, and understanding of the mission of cross-systems crisis prevention and intervention that are the key to your success. I wish you all well, and thank you for listening.